I'm Semaan and I'm a licensed psychotherapist. If you've been to my channel before, thanks for tuning back in. And if this is your first time joining me, thanks for being here. Before I get started today, let me just provide a trigger warning to my viewers that the content of today's video may be triggering, so please be mindful if you choose to watch it. Today I'm going to talk about trauma, I'm going to define trauma, and I'm going to share with you some of the reactions we have to traumatic experiences. So if you want to learn more about this, please stay tuned. If you found yourself to be enjoying the video, learning from it, please remember to give it a thumbs up, leave a comment with any questions, feedback, or suggestions, and subscribe to my channel for more videos. As I said, today the topic is trauma. So first off, let's define trauma. Simply put, trauma is a very distressing or disturbing experience. Nothing more, nothing less than that. It's an extremely distressing or disturbing experience. Now, why do we toss the word trauma around so loosely? Why do we hear so many different definitions? Because the way we experience trauma is different for each individual person. What is traumatic to one person isn't necessarily traumatic to another. And trauma doesn't always mean PTSD. I'll get more into that in a little bit. For anything to qualify as trauma, we have to remember that trauma is not a diagnosis. So we don't have a specific set of symptoms in the DSM-5 that tell us this is trauma. So that's why it's a pretty subjective experience. What happens here is we're looking for difficulty processing an experience or difficulty making meaning of an experience. Trauma can be simple trauma and it can be complex trauma. Simple trauma is one isolated event, for example, being robbed at gunpoint. Complex trauma is repeated exposure to traumatic experiences, usually of the same nature. So for example, a child who had been exposed to sexual abuse for several years throughout their childhood would be considered in the complex trauma category. When we think of trauma, we usually think of two things immediately. We're either thinking of war veterans and combat warriors, or we're thinking of childhood sexual abuse. Those are extremely traumatic experiences, but they are not the only ones. A lot of things can be perceived as traumatic to the individual. Some people experience car accidents as a traumatic experience. Others have explained to me that their chronic illness feels like a traumatic experience. Abusive relationships can be a traumatic experience. So again, there isn't a right or wrong for what is considered traumatizing. If it's causing significant distress to you, and if you're having difficulty making meaning of it and finding a way to fit it into your day-to-day life, chances are you've experienced a traumatic experience. As I said earlier, trauma is not a diagnosis. And trauma doesn't always lead to a diagnosis such as PTSD or post-traumatic stress disorder. PTSD, I will make a video about it in the future because I'd like to address it alone as a diagnosis. But please, just for today's video, just remember that PTSD and trauma are not the same thing. Trauma is an experience. It's a significantly distressing experience that we go through, and PTSD is a mental health diagnosis that has a specific set of criteria per the DSM-5 that we have to meet for us to be diagnosed with it. There are four main categories that we call trauma reactions. So in other words, there are four different ways our minds and bodies react to traumatic experiences. The first category is called re-experiencing the trauma. So how do we re-experience the trauma? Obviously, it's not something we choose to do. It can happen through nightmares, which are really scary, vivid dreams that happen when we're sleeping at night. It can happen through flashbacks. This is when we're alert and awake, but our mind takes us back to a traumatic experience that we went through. It can happen through significantly distressing thoughts and emotions about the traumatic experience. And it can happen when we experience significant distress after having that trauma reminder. The second category is avoidance of trauma reminders. So, of course, we don't want to experience those nightmares. We don't want to experience the flashbacks, the distressing thoughts and feelings. So, some people turn to substances to numb themselves from re experiencing the traumatic situation. So, people may drink excessively or use drugs in an excessive manner. Other things we see is avoiding situations, people, and conversations that have to do with a traumatic experience. So, let's say someone had an experience with sexual assault on campus. They may find themselves avoiding going back on campus for an entire semester because they don't want to re-experience that traumatic situation. The third category is negative thoughts and feelings about the traumatic experience. Here we are looking at people who blame either themselves or others for that traumatic experience. We are looking at a loss of previously pleasurable activities. We're looking at social isolation, so the person wants to be disconnected from people. Other things that could happen are loss of memory of that traumatic event, or excessive negative thoughts about oneself or about the world. So these are examples of what it means to have negative thoughts and feelings within the context of trauma. The fourth category is hyperarousal. So this is when a person is very jumpy, irritable. They feel like they can get angry or anxious very easily. They feel like they're always on their toes, so anything can set them off. Other examples are being hyper aware of the surrounding. You can see them constantly scanning the room to make sure there's no reminders of the traumatic experience. Some people experience difficulty sleeping in this category. They feel like they always have to be on high alert to make sure they keep themselves safe. Other things we see within hyperarousal is risky or impulsive behaviors. So to recap, the four main categories of trauma reactions are re-experiencing the trauma, avoiding trauma reminders, having negative thoughts and feelings about the traumatic experience, and having hyperarousal. So a person may have symptoms from one or more of these categories, and all of them are normal reactions to trauma. What I hope is your takeaway from today's video is that each person's experience with trauma is different. There's no right or wrong way to be traumatized. I mean, it's just an awful situation to be in, and my heart goes out to everybody who's experienced a traumatic event from any category, from any perpetrator. So let's all just be kind to one another. Let's remember that every traumatic experience is valid, and you have the right to seek support and help if you feel like you've been through any trauma in your life. I hope you enjoyed today's video, and I look forward to seeing you all in my next one.